Omicron spike that we are seeing. We'll also continue a strong recommendation that if you can work from home or indeed study from home, that you should, and all of these orders will continue to be under active monitoring. I'll hand over to Professor Cowie, who will take us through more detail, particularly on the issue of how people who turn positive from rapid antigen testing will become part of our pandemic response. Thank
you. Thank you, Minister. So, given where we are at this stage of the pandemic, with really quite significant transmission of the Omicron variant in the community, and with the attendant very significant pressures on our PCR testing system, and with the millions of rapid antigen tests that Victoria has ordered about to arrive, it's clearly time to recognise that a positive rapid antigen test has the same authority as a PCR test. And certainly we know that based on laboratory data coming in, greater than 90%, and in some laboratories greater than 95% of people who have a positive rapid antigen test go on to have that positive result confirmed by PCR. So in the current environment, rapid antigen tests provide a really high degree of diagnostic authority. And that's why other countries around the world, including, for example, the United Kingdom, did shift to the use of rapid antigen tests in a similar way when they got to this point. So this is the biggest change to our testing system since the start of the pandemic. And in terms of context, I think it's important to reflect that the number of people that our PCR testing system diagnosed yesterday was greater than the number our PCR testing system diagnosed for the entire of 2020. And it's likely that in the first 10 days of this year, our testing system will diagnose more people than it did all of 2021. That's the sort of volumes we're talking about here. So these changes mean that people who, as the Minister said, who have a positive rapid antigen test will be considered as probable cases of COVID-19 and subject to the same requirements as people who have had a confirmed diagnosis through PCR. They must isolate immediately for 7 days and notify their contacts. It will also be mandatory for those individuals to report the result, the positive rapid antigen test result, to the Department of Health through either an online form or by phone. And this will allow the department to confirm case details, to monitor the ongoing spread of COVID-19 through our community, which is incredibly important for supporting planning around our health system responses, and perhaps most importantly, ensure that people can still access care if their symptoms are deteriorating or if they've got risk factors for progression, and also to access welfare and other support.